welcome to Couched in Color with Dr. Alfie. I'm your host, Dr. Alfie. This is the show where we talk about all things mental health for teens, young adults, and the families and communities that love them. Welcome. For this month of May, it's Mental Health Awareness Month, and we're going to stay with that theme as we always do, and bring you a series of shows related to all things mental health, particularly for our young people, but also focused on special populations and populations that we may not always get to center and focus. So we hope you'll stay with us. We know that you'll learn a lot, and we're really looking forward to bringing you all things mental health for our young people, our young adults, and everyone who loves them. Thanks for joining us. We're going to have a wonderful opportunity today to talk with one of our experts in the area of mental health for African Americans, people of color, people of marginalized backgrounds, and just people in general. And it's my pleasure to welcome my guest, Dr. Earl Turner. So welcome, Dr. Turner. Thank you for joining us. And where I always Yeah, of course. And where I always like to start is I like to have people just do a brief introduction, as long or as short as you would like, and tell us a little bit about you, what your interests are in this, in the context of mental health. So, like, what are you passionate about? What are your areas of clinical and research expertise? Just anything you want to tell us about who you are and how you're situated in this conversation around mental health. So please go right ahead.
Okay, great. So I'm primarily currently a professor at a university here in Los Angeles. I'm also a licensed psychologist and have been licensed for almost 10 years. And then I also, I host a podcast, The Breakdown with Dr. Earl. And I do a lot of work around mental health awareness. And I think for me, I'm really passionate about that work. And so I try to apply my own research as well as research related to diversity and multicultural psychology to different communities, and more specifically with African American families, and understanding what are some of the dynamics of understanding how to get them engaged in treatment, and also focusing on the clinical aspects of training professionals, specifically mental health providers and psychologists or therapists, about what are some of the unique perspectives that we need to take into consideration when we're working with communities of color.
Excellent, excellent. So as an African-American man, what I'm really curious about is just from your perspective, from a gendered perspective, are there certain things that we need to be paying attention to, both as mental health professionals, as mentors, parents, loved ones, peers of young men of color or men of color in general? What would you say are some of the things that is really important for us to be aware of as it relates to Black men, young men of color in general, and their mental health?
Yeah, so I think there are a couple of things. I think one of the conversations that I have often on my podcast are related to issues around sort of masculinity norms and gender role socialization, and specifically when it comes to boys and men engaging in conversations around mental health and talking about the emotions and feelings. And I think that there's this sort of context of thinking about culture, regardless of what community you belong to, that really shapes males' role in terms of how they feel comfortable talking about those conversations, but also what the context is when they have those conversations. So I think that if you talk about mental health when it's maybe a group of men, that those conversations might be different, and they may be more comfortable feeling like they can sort of let their walls down and open up about their mental health and about stress and things that are going on, as opposed to when they may be in a therapy room and those conversations may feel like they may be more hesitant to maybe open up about those types of issues, specifically if it's across the gender dyad. So if they're working with a female therapist, that it may be more difficult to get them to engage. And I think part of that is just how therapists are trained to, in so many words, therapize individuals, that the language and terminology that we use to try to connect with men and boys in therapy is always not as comfortable and doesn't necessarily meet them where they are in those conversations. And you may push too quickly to try to get them to maybe be emotional or talk about their feelings. And then that's when they maybe close themselves off and put walls up, because they're not ready to really engage in that particular dialogue under those
Mm-hmm.
circumstances. So I think that that's one issue that oftentimes comes up. And I think part of that, for me, conversation starts at an early age where we really encourage boys to withhold talking about their feelings and emotions, and that you have to always sort of be tough and sort of have this armor on. And so I think it makes it difficult for them to not want to sort of live up to these stereotypes in terms of how we think about expectations around sort of masculinity and what it means to sort of talk about emotions.
Yeah, so everything that you're describing is really important for me to hear, and it's really important for our audience to hear. And I think that part of what you illuminate for us is this idea. I know it's something that's important to you, and I think it's fair to call it gender role socialization, how we socialize boys to be boys, right? And so you
Mm-hmm.
talked about a couple things. It's not talking about your feelings, it's being tough. It's like there's only one way to be masculine. And what I'm really, I like this just came to me as we're sitting here talking about it. What does that mean for young men and for boys who don't feel like they need to fit those, or who feel like they don't, but just by nature they don't fit those norms? So it makes me think of this. It's something I saw on social media, and I don't remember where I saw it. I think I saw it on Twitter first. And there was a man. It's a story where there's a man talking to a little boy. I think they're in a classroom, and the teacher tells the boy to, like, stop crying and be tough. And then I
Mm-hmm.
think it's two black men conversing. I think that's what it's supposed to be. And then the little boy looks at the man and says, "But I'm allowed to have feelings, right?" And the guy said he just stopped. He was like, "Yeah, yeah, you are." You know what I mean? So it was sort of he was checking himself on the
Mm-hmm.
message he was giving to that little boy in that scenario. And the boy was the one who had to be like, "Look, right? I'm supposed to have feelings too." So can you talk a little bit about your expertise in this area? Elaborate on what you shared just before about
Mm-hmm.
these gender role socialization and what that means for the mental health of black men or men, young men in general.
Yeah, I mean, I think part of it is that for specifically young boys as they're growing up, when they are told these messages either
Mm-hmm.
directly or indirectly, like you just mentioned, where he's witnessing sort of these interactions between
Mm-hmm.
adult males, or either if maybe their fathers or uncles or
Mm-hmm.
other relatives that may be having conversations with women in their lives,
Mm-hmm.
that they learn that these are the expectations around how I'm supposed to behave, and
Yes.
whether that's tough, and that equals manliness.
Mm-hmm.
And when I talk about my emotions, or I cry, or I express my feelings, then those are not masculine, or those are the feminine qualities. And I think for a lot of communities of color, and I'm
Yes.
going to just sort of speak specifically for, I think, the Black community, that for a lot of young boys, when they are young and they express their emotions, that you're called a sissy, or you're called gay, or all of those types of negative derogatory terms. And so they may internalize those things regardless of how they may even sort of identify in terms of their sexual orientation at that particular point in their life. And
Mm-hmm.
so it does make them be at a much higher risk of experiencing things like depression, for example, because
Mm-hmm.
they can't be themselves and live up to who they are,
Mm-hmm.
again, whether regardless of how they identify in terms of their sexual orientation. They can
Mm-hmm.
be identified as heterosexual, but
Mm-hmm.
because these sort of expectations and connotations around masculinity and talking about your feelings are gendered oftentimes, then
Mm-hmm.
they may be less likely to feel comfortable expressing those things, particularly when it's in an environment where they don't feel supported, or they feel like they may be judged by how they behave, whether that's by other men or boys, or by the opposite sex
Mm-hmm.
as well. And so I think we have to really encourage and teach boys that it's okay to express, the range of your emotions
Mm-hmm.
outside of just anger. I think anger is one of those emotions where, specifically for boys and men, that we are often taught that it's okay to be mad or to be angry.
Mm-hmm.
But if you're sad, or you experiencing depression, if you're anxious, if you're worried, those are emotions that are less encouraged to be expressed
Mm-hmm.
in a lot of communities of color.
Mm. It just sounds like a lot of weight that we ask our young boys to carry. And it sounds, I'm also thinking a little bit about our boys who may be questioning gender identity or sexual identity, are transgender young people. So I'm just thinking about if you get these, there's sort of these scripted messages about what it means to be male and what it means to be female and what you're allowed to do within that context. So all of my family is from the South. And I think you have some Southern roots. So I know you were trained.
Mhm.
Didn't you go to
I'm
Louisiana
from
State?
I'm from the South. I'm from Louisiana,
There
and
you
I've
go.
trained
Oh, there you
I've
go.
trained in Texas, and so
Yeah.
the majority of my life, both growing up in adulthood,
Mm-hmm.
I've lived in the South. Outside
Mm-hmm.
of I live in Virginia, Baltimore, Maryland area.
Mm-hmm.
Some of my postdoc training, but
Mm-hmm.
my roots are in the South as well.
So it's just making me think. I mean, I think it's a great conversation, and I think about the messages that I see young men getting, and I know it varies depending on where you are in the country, and I know there's some parts of it that are universal. But one of
Yeah.
the things I can remember growing up in my extended family's from Mississippi. I grew up in southeastern Virginia, which my husband quibbles and says that's not the deep South. So I'm gonna leave that there. But when I think about extended family like Mississippi, Alabama, that kind of thing, I think about the messages that I remember boys getting when I was little, right? So it was like you just said, it's all about being tough and boys don't cry, and we would use language like some terms were derogatory, but then other terms, like I have a mentee. His name is Dr. Kevin Nadal, and Kevin, I think one of Kevin's books is "That's So Gay."
Hmm.
And you know how people take a term that really has no negative connotations to it at all, but they use it, right, in a negative way. And so we sort of label children negatively for doing what comes natural to them. And so I think as you encounter, like I'm thinking about parents out there or mentors, or, I'm thinking about just like even parents of college age young people. When you encounter your loved one or somebody you care about who happens to be male, identify as male, and they look like they're struggling, maybe they are starting to exhibit some of these signs and symptoms of depression. There are two things I want to ask. One of the things I want to ask is, would you say that sometimes anger, right? I won't call it aggression. Let's say assertiveness, because aggression is loaded.
Yeah.
When we see this in boys, do you have ways that you can teach us or educate us about making that distinction between, like, maybe he's has a conduct or a behavioral problem versus this child might be, or this young man might be dealing with depression or anxiety or something like that. I don't know. And it's kind of it's a big question, but that's
Hmm.
something that, comes up for me a lot. Sometimes when we look at these young men, we will label them as one thing, and that's really not what they're dealing with at all. Those are just the ways they've been socialized to acceptably
Yeah.
express, right? That's what's acceptable. So I know I'm sort of a all over the place question, but talk a little bit about this relationship between these masculine norms that boys are socialized with or young men are socialized with, and this idea of how you know when it's depression versus how do you know when it's something else.
Yeah, I think that's a good question, and I think I've tried to grapple with that a little bit myself on my own podcast. And I think that part of it is that, again, this idea about um, anger as an emotion is one that is deemed to be. I'm going to make this assumption that it's deemed often for many communities that this is a masculine
Yep.
emotion that you're
Yep.
allowed. It's acceptable to
Yep.
be angry.
Yep.
And for me, I think anger is one of those emotions that can be related to a lot of different feelings. And I think for men, as you sort of alluded to, and maybe boys as well, is that that's not the primary emotion or feeling. There's something else underlying that
Mm,
anger.
mm,
But because of the expectations that we may be socialized to believe, is that if I'm sad, if I'm worried, whatever other feeling is under that, what I'm going to show the world is my anger.
mm, mm,
And so because they are going to notice that, and then they're going to either give me my space or they're going to try to engage me about sort of what to do with that anger.
mm,
And so I think for parents and clinicians that are working with boys, I think what's important is that you really try to open up a conversation and try to understand
mm,
what they're going through without jumping the gun to make that assumption about why are you angry.
mm,
Instead, you can use other language to say what's going on.
mm,
And so
mm,
I think that's a conversation that for again, sort of contextualizing things, if you're in a group of men
Mm-hmm.
that they may have those conversations about, hey, what's going on, and frame it more generally, as opposed to saying, why you got mad? And so I
Right.
think those are the ways that we oftentimes approach boys and men when they exhibit anger, is that we just label that emotion for
Yeah.
them
Yeah.
without allowing them the opportunity to really describe what is it that's going on internally with you in that situation. And so I think that because of that socialization process, sometimes you even have to you even maybe without thinking about it, you may subconsciously behave in ways because you are trying to meet these expectations about
Mm-hmm.
what it means to be, what's manly. And
Mm-hmm.
so I think those are the things that we have to really move away from, and really allow boys and men to be able to express what are these feelings that are going on inside of them, and be able to sort of open up those conversations, as opposed to you sort of saying, well, this is what I think you're feeling in this situation, and how are we going to deal with this feeling that I think that you're experiencing at this particular moment.
Ooh, I love that. I like that is translatable and portable across so many um, scenarios and settings. So, for example, as you're talking, I immediately my mind went to, instead of us labeling, you said the part of, instead of us labeling for the young people, what is it, or for a man, what is it, asking them what's going on and making it much more open ended. I can envision teachers using that in the classroom, right? We think about this whole thing of school to prison pipeline. Some of that is because we label what we see, right? And then we treat what we've labeled, as
Mm-hmm.
opposed to treating what is actually there. And the only way you can know what's really there is to ask the question, and you have to sit back and listen. So, this idea of sitting back and listening, I know you know this from your doctoral training. Break down for us, and it's probably something that's in your book too. So, first, tell us a little bit about your book, your new book. And then, second, maybe there's some education you can give our audience, excuse me, about how a parent, adult, a loved one, a mentor, a partner, right, a spouse, or somebody, a dating partner, how can we effectively listen to a man? What can we do to elicit the conversation first, and then be a good listener, such that that man, or that young person, or that boy knows that we are attending to what they need? What would you say? So tell us
Mm-hmm.
about the book first, and then maybe you can
Yeah.
lead into that. Yeah.
Okay. So my book is about African American mental health. It's called Mental Health Among African Americans, and the book is geared towards primarily clinicians
Okay.
or mental health providers, and really having them understand what are some of the issues that might be important to understanding, barriers to treatment.
Okay.
So I think that's a conversation that we've been trying to tackle for
Yes.
decades in terms of
Yes.
mental health service use in this
Yes.
community.
Yes.
And so I address some of those things, and really trying to focus on sort of my conceptual model about what are these factors that might impact treatment use among
Mm-hmm.
African American populations,
Mm-hmm.
and really thinking about sort of some of the nuances of that, and
Mm-hmm.
that it's always not about whether someone has the financial ability
Mm-hmm.
to access services.
Mm-hmm.
Part of that might be, are there providers in their community? Are there trained providers? I think that's a conversation that we oftentimes negate talking about. It's not just about whether you have training in a particular treating a diagnosis. Do
Mm-hmm.
you have training or working with someone in that community and have had success with understanding some of the cultural factors, but also making sure that you apply context? And so I think, just sort of adding to something that you touched on earlier, this idea for individuals in the African American community or Black community,
Mm-hmm.
that they are living in spaces where oftentimes they may experience oppression, or may
Mm-hmm.
have, if we sort of contextualize things right now with what's going on with the pandemic,
Mm-hmm.
they may not be getting adequate healthcare services for a number of different reasons. So
Right.
you might be experiencing some sort of emotion related to something that's not directly connected to this sort of mental health issue that you may actually be coming in for treatment for. And I think oftentimes as providers, we don't really think about sort of what's the context about how you might exhibit some of these particular behaviors or emotions. And so I think that's, one important consideration that I talk about in the book. The other piece of it is really thinking about what are some of the contextual things about sort of that therapeutic alliance,
Mm-hmm.
and that for many communities of color, that how you form a relationship
Mm-hmm.
with your mental health provider is really important to whether you're going to keep coming back to
Mm-hmm.
them and
That's
working with
right.
them.
That's right.
And I think oftentimes what we know from the research is that dropout rates tend to be fairly high
Yep.
for communities of color.
Yep.
And so within, I would say, the first, 2 to 3 visits, they are either going to make decisions to actively communicate to you that they're not going to come back, or they
Mm-hmm.
just drop off and you don't know sort of what happened. You may make some
Mm-hmm.
assumptions about, well,
Mm-hmm.
they're not interested anyway in seeking out services. Well, maybe they didn't have a good relationship with you or think that you were going to be able to help them. And so they decided, I'm not going to go back to this person. So those are some of the things that I talk about in my book to really have clinicians think about what are some of these factors that might be important to consider. And it's not always about the person having, stigmatizing views about mental health
Yes.
services. There are a lot of African Americans and Black community people and others in communities of color that don't necessarily have stigma about services,
Right.
but because they've had some negative experiences about it,
That's
or
right.
because of the judgments and biases that clinicians might have towards that community, they're less likely to feel comfortable that this person's going to be helpful in terms of addressing the concern that they may be coming to work with you for. So I think those are important things that I like to touch on, that I do touch on in the book, that I think clinicians need to really think a little bit more about from sort of a more sort of conceptual and really
Yeah.
thinking about sort of the nuances of working with different communities.
I love it. And what you described, we, put under this umbrella, because you and I have a relationship that goes way, way back. And we're both very invested in this idea of what does it take to engage people in treatment, right? This whole umbrella term of treatment engagement. And everything that you've described is rapport building, it is availability of culturally competent, culturally relevant, culturally resonant providers. Do I see
Mm-hmm.
people? They don't necessarily just have to look like me, right? But if I walk in, I was doing the podcast with a colleague who happened to be white a few weeks ago, and when she logged in, she was like, "Hey, girl, hey!" I was like, "See, yeah, she know what's up." You know what I mean? So it's little things like that.
He gets
It can.
invited to the barbecue.
That's exactly. She get invited to the barbecue because Kimberly know I love her, because at least she has an awareness, right? So it's not just that, but that's an example of how you demonstrate that you have some knowledge, right? That you've taken the time to to expand your horizons and try to learn about other cultural groups and other people. So, I hear people say a lot this idea of, well, I can't possibly learn everything there is to know about every single solitary culture. I can't learn everything about Filipino culture and then Hmong culture and then Sioux culture and you know what I mean, like, and then Arab culture. But that's not really what we're talking about. What we're talking
Mm-hmm.
about is having a framework and a set of concepts and a set of guiding principles that allow you to be welcoming, right? You talk about this whole thing about diversity, equity, and inclusion. This sort of that in practice. How do you demonstrate that when people come into your office, right? Where are you advertising as a clinician?
Mm-hmm.
What do the pictures look like what do the pictures look like hanging on the wall? When I look at you and I'm looking in your office and I see that sign back there, 0608, yeah, we're gonna claim that. Do I know what that means without you having to explain it to me, right? So I've had experiences where, I've talked about belonging to a sorority, and I've had people say, "Oh, are you the pink and green, or the red and white, or the blue and white?" I'm like, "Oh, you know what's up." So, okay, you do know something, or the blue and yellow. I can't leave out the SG Rose. So having just a knowledge, right? Like having a breadth of experience, I think is really important and critical for clinicians. And I want to shift gear just a little teeny bit and talk about on a one-to-one relationship, right? If you have a man in your life, or if a person has a man or someone who's male identified or masculine identified in their life. And we shift that conversation from the rapport building that has to happen in a clinical setting. And we talk about the rapport building that may need to happen in a family, right? Or in a
Mm-hmm.
friendship, so that person can feel like you are a person they might be able to come and just broach the conversation of, I haven't been feeling so hot, and yes, I've been angry. And it's funny because I had a conversation earlier today where my guest said that he snapped at another male who's close to him, and he had to go back, the next day and apologize. You know what I mean? Like, and so to me, I was like, oh, like it was just eye opening, because what he was saying was he recognized that his behavior was such that it might be hurtful to the other person. Right. And I thought, for a man to say that, right, I know it sounds stereotypical, but I don't know that we encourage men always to do things like that. So he did it. He knew it probably wasn't right, and then he went back and he fixed it. How healing that can be, and how much modeling he was doing in that moment to say, yeah, you might have made a mistake at this point in time, being angry or being short, but you can fix that. So, what kind of things can you offer us to help us be better for the men in our lives, to let them know that we're open to listening, right? That how do we build that rapport, do you think, in your opinion, as a professional, and as a man, how do we build that rapport so young men and men know I am a person who will listen to you? I am a person who you can open yourself up to when you're ready. What kind of things can we do?
Yeah, well, I think one is sort of going back to the point that I mentioned earlier about sort of not jumping to label their behaviors or emotions without having them sort of tell you that this is how I'm feeling.
Mm-hmm.
So I think that's the first step.
Mm-hmm.
The other piece of it, I think, is allowing men to approach those subjects when they are ready. And so I think not trying to always be in the back about, hey, what's going on? You want to talk about it? Let's sit down. Let's have a talk. Let's, I've noticed you've been doing this. Let's talk. I think you have to sort of approach them to say, hey, you feel like talking right now? If they say no, back off. They will. That at least provides an opportunity for them to for you to let them know that, okay, this person is really interested in understanding what's going on with me or how I'm feeling. I may not want to talk about it right now, but at least I know that they may be open to that. And then when I feel like I'm comfortable and I'm ready to do that, then I can be able to say, you know what, I want to talk. You were asking me the other day about, how I was feeling or why I was upset or why I was moping around. This is why I was feeling that way. And I think that is a big step to allow men to sort of meet them where they are, and boys as well, as opposed to saying, you know what, let's sit down, we're going to have a talk, we're going to talk this through. I may not be ready to talk through right now. And I think, for me, as someone who's done some work, with families as well as couples, that communication piece is key. And for some people, they need time, whether that's a couple of hours or a couple of days, to get to a space where they can be able to actively open up about what they may be experiencing internally. And I think as a society, oftentimes we are so quick to jump like, okay, this happened, let's deal with it and work through it now. Everybody doesn't or is not in the space to be able to do that. And I think that's one of the things that makes it difficult oftentimes for many families, couples, individuals, where we are in a situation where we are not feeling okay. And so because I'm not feeling okay, we need to talk. Well, maybe the other person isn't ready to talk right now. And so I think we need to get comfortable saying, you know what, I'm not feeling good right now, or I notice that something seems, off with you. Do you want to talk? And I think we need to just sort of be comfortable opening that door. And so I think sort of connecting it back to sort of that therapy moment. Oftentimes we're taught to get comfortable to deal with silence. That's not a natural behavior. We have to learn that. And so I think for people who are not clinicians, we are naturally ready to say when we are experiencing something or we notice someone is experiencing something, let's deal with it. Let's talk about sort of what's going on and what emotion you're feeling at that time. And so I think we need to learn to get comfortable sort of with being uncomfortable, so to speak.
Oh, I love that. I think that's really, it's very educational for me, I have to say, because I think as a woman, I know one of the ways in which women are socialized, we are socialized to be like relational, right? Like you're always relating, whether that's the conversation, whether that's your body language, the words you're using. That's how women are socialized, right? So it's always engaging. That's why that work, there's a woman by the name, I think her name is Professor Nikki Crick. Even in aggression, right? With women, it's relational aggression, right? It is not fist fighting. It's I'm gonna talk about somebody or I'm gonna ostracize that person. You know what I mean? It's something that's, you're impacting them from a relational perspective. And I think what you're articulating is for men in this space of us trying to find the best way to engage and communicate. Sometimes the best way to engage and communicate is to initially allow for the disengaging. Do you know what I mean? Like to allow for the silence, right? You don't always have to be talking to be communicating. Sometimes communication is you see how I want to be engaged or how I don't want to be engaged, and you respect that. That in and of itself is creating the right tools for engagement under the right circumstance. Like, so as you're saying, a young man may need to be ready to have a conversation with you, and he may not be ready when you're ready. So you got to give him the space to get ready. And then when he comes to you, then you can have the full conversations that you want to have instead of us trying to push it. So I guess I'm just articulating that that's very helpful for me to hear from someone whose opinion I respect and someone who's a professional and also someone who's not related to me, right? Because the men in my life, I'm sure they're going to be very happy to know I have am being educated to back up off them for a little bit, right? I know my son is going to be very happy because it's funny. He and I were talking like this was probably months ago, and that's what he said. He said, sometimes you have to know to just ask the question and leave it alone. And when I'm ready, like it's very profound, my little 13-year-old, when I'm ready, I'll come back to you and then we can have the conversation. I was like, okay, fine, right? But that's not how I want to deal with it all the time. I'm like, I want to talk now. Let's talk now. And so I appreciate you giving us that education about sometimes that's not the way to approach it.
Yeah, and that goes back to not to jump in, but it
No,
goes
you're
back to
fine.
the idea about, we've been talking about sort of gender role socialization. And I think at a very young age, we're socialized how to behave that way. And so for girls, they're taught like, okay, you need to do this, go talk, go do these types of things.
Go
And
work
boys
it out.
go outside. And so I think as boys get older and into adulthood, like they get comfortable like behaving in ways that, I can, and I have a lot of my friends now that we don't talk very often.
Right.
But when we do, it's
Right.
like we just talked yesterday.
Right.
And so I think those are some of the differences when it comes to like men and women in terms of like the socialization pieces that, men can they can have a really close relationship. But if you ask maybe a woman about that relationship, she may say, well, they're not that close. Well, in their mind, they are close, even though they don't, talk as often or see each other. So I think those are, again, some of the sort of the things that I think for us as individuals, but also as professionals, we don't oftentimes think a lot about. And so when you put men and boys in this sort of therapy setting,
right.
To sort of go back to that point, is that then we sort of overwhelming them with all of this relational stuff, and depending on who they are, they may not be ready for that right now. And so you're going to come up with a lot of barriers, and he's going to be like, I don't know how I feel about this person. And so
right.
they're done.
Right. Oh, that's very enlightening. I'm laughing because as you're talking, I'm thinking of the men in my life and like, again, how happy they're going to be that somebody's telling me that this is how I need to be engaged in them. Do you know what I mean? And so you're absolutely right. This whole idea of, I can think of a couple men in my life where if you were to ask me about their friends, I would say what you just said. I mean, they cool, but they ain't close. And I know for a fact, because I've heard some of them say in their mind, that's their boy, right? They are tight. You know what I'm saying? Like, what are they down like four flats? People used to say that's their ace. But I don't see it because they don't talk all the time. Whereas my crew, was the PRR crew, I have to always shout them out. We are in communication pretty regularly, whether it's texting or whether it's now we're doing the Zoom or like when we could be together, we were always trying to, we haven't seen each other in a whole month. Let's get together. It's that kind of thing. So that is like, it's profound in its simplicity. And I'm going to like really digest that and really try to use that to help me, in my personal relationships with the men in my life, the men and boys in my life. So I want to shift gears just a little bit and have you talk a little bit about some of the media work that you do. So I saw today, I think it was something about WebMD, and I think you have been interviewed for WebMD, and I want to mention, I think it was in the context of Taraji Henson's foundation, the Boris Lawrence Henson Foundation. Shout out to Tracy Jade, that's my girl, whom my nonprofit, we have a partnership with them around this virtual therapy that they're doing. So tell us a little bit about, and because I saw it today and I saw you associated with it, just give us a little bit of information about your media work. And while you're doing that, also tell us, are there places in the media sphere where people can find you so they can be connected with you?
Yeah, so I'm going to start with the last question first.
Okay, sorry.
And that you can connect with me on social media, Twitter, Instagram, and Facebook at Dr. Earl Turner. And my website is Dr. Erlanger Turner. And all of my information is related there in terms of how you can contact me about media stuff or being interviewed for different topics related to mental health. And so for me, again, like doing the media stuff is really connected to this idea for me about providing education around mental health, addressing some of the stigma, providing resources to individuals about how to recognize different types of information. And so I oftentimes will do in addition to the other hundreds of things that I'm doing, do some trainings for the public about sort of mental health awareness. And so I think those are really central to why I'm passionate about this stuff. And so that's really why I get into some of the media work. The piece that just came out with WebMD is more specifically around just sort of thinking about mental health awareness and why it's important that we have clinicians who are more culturally competent and sensitive to work with different communities, regardless of what their background is. So Black community, Latinx community, LGBTQ plus community, that if we don't have that central understanding about trying to understand someone and who they are, that is going to make it much more difficult for them to sort of establish that relationship. And then the other piece of that, I think for me, is that, I get people reaching out to me, and I'm not currently seeing clients, but I think a common theme that comes up is that people oftentimes want to work with the clinician that looks like them. Obviously, the field is not as diverse as we would like it to be. And so the chances of finding somebody that looks like you is going to be very difficult and challenging. But on top of that, I think for the general public, sometimes they don't really make the connection between, not only does this person look like me and can help me out because I would feel comfortable working with them, but do they have some training and expertise related to the issue that I may be hoping to get, some help with. And so I think that's the other piece about why I like to talk about, mental health with the public, is that it's also important for you to also ask, have you worked with somebody that looks like me? And have you worked with somebody with this particular concern? So whether that's, relationship issues, if it's, the coming out process, if it's trying to deal with my anxiety, being able to check in with that person, because not everybody specializes in those types of things. So I don't do substance abuse work. So if someone wanted to work with me, I wouldn't be the best therapist for them. Although I've worked with people from different diverse backgrounds that they may belong to, I'm not the person that's going to be able to get you where you need to be when it comes to that particular concern.
Excellent. So this has been just a lovely, like a wonderful conversation. I feel like I've really learned a lot. And one of the things I like to do with all my guests is this little reflection exercise. So anybody who's seen my podcast knows, what's coming. And I'm going to shout them out again. Y'all going to endorse me whether you know it or not. It's affirmators, right? So here are the affirmators. I love these things. And this version is affirmators at work. There are lots of different affirmators. So for family, for kids, there's like regular affirmators, but we're going to deal with affirmators at work today. So what I want to ask you to do, please, is pick a number between 1 and 20.
I'll pick 15.
Okay, 15. All right, so I'm going to count 15 cards, and then we're going to see where we end up, and I'm going to read it to you, and I'm going to ask you to reflect for me, okay? All right. It's going to take me a second. Almost there. Okay. So here's our card. I want everybody to see it. This is our card. All right. And I'm going to read it to you. And then you reflect on it for me. Follow through. I turbo boost my stamina and activate the power of commitment, enjoying the satisfaction that comes with following through on everything I start. This week, everything is getting the follow through treatment. No missed deadlines, no forgotten email threads, no sitting around here while there is a perfectly good happy hour going on right now, somewhere, maybe even across the street. Show some commitment, people. So what do you think about this idea of follow through?
I think it's, especially now, this idea about follow through is definitely resonating with me, because I think I've been definitely trying to make sure that I follow through with things that, deadlines that I have right now. But obviously there are going to be challenges sometimes that happen in life that make it difficult for you to be able to follow through on every, specific task that you may have, set for yourself, or your every specific goal that you may have set for that particular day or week. And so I think we have to be mindful for ourselves. And for me, I try to be mindful as well about, having these goals and expectations about following through on everything that I commit to, but also being gracious with myself when, if I said I was going to, get these, 3 things done today, but I only got 2 done, that's not the end of the world. And that it's okay to not follow through on every, task, as long as there's a reason for that. And if you're committing yourself to others, that you can be able to let them know, like, hey, this happened, I apologize, and that hopefully they'll be okay with that, and it's not, that detrimental if you don't sort of meet that particular task. So I think it's important that obviously you want to, be responsible and follow through on the things that you commit to, but you don't want to beat yourself up. And I think sometimes that when we sort of don't meet these certain goals that we have for ourselves, that we're really hard on ourselves, and then that can lead to some other downward spiral into some other challenges.
All right. Well, I appreciate you so much, Dr. Earl Turner. The name of your podcast is called The Breakdown with Dr. Earl. Did I get that right? All right. And you have this new book. Tell us the name of your book again.
Mental Health Among African Americans, Innovations in Research and Practice.
Excellent. You can see you back there in the background, so make sure y'all go out and get yourself a copy of that book from my brother here, Dr. Turner. And thank you so much for your time. And sorry for the technical glitches in the beginning, but we really appreciate having you on. And I'm looking forward to sharing this, your information with everybody, particularly about these issues of mental health as it relates to men and boys. So thank you so much.
Thank you for having me.
All right. So there you have it. A wonderful conversation with a clinical psychologist, Dr. Earl Turner, who has a new book. He also has a podcast, and it was just a really great opportunity to listen to and hear more about what it means to care for and love and support the mental health of the men and boys in our life. So as always, we want to wish you lots of love, lots of light, and I'm always hoping that it's informed by good culturally relevant science. And of course, please go subscribe on our YouTube channel and follow us wherever you get, and subscribe, of course, wherever you get your podcast fix, whether that's Apple Podcasts, Spotify, Libsyn, wherever you need to go to get that podcast fix, because it's portable. So take us with you, learn a few things, and then make sure you reach out to us and share your thoughts either on our Instagram page or Twitter. Or you can always leave a comment right there on YouTube. So as always, thank you so much for joining, and I look forward to joining you the next time on Couched in Color with Dr. Alfie. Take care.